The SUDEP and Seizure Safety Checklist is a valuable resource for any health professional who sees people with epilepsy. The checklist helps facilitate compassionate conversations with patients about the risks associated with SUDEP and other potential epilepsy-related deaths, ensuring that families receive the support and information they need during challenging times. Up to 80% of epilepsy-related deaths are thought to be preventable. Educating patients and their families about the associated risks is a crucial step towards enhancing safety and reducing the likelihood of such tragedies, allowing them to take informed actions to protect themselves and their loved ones. While some health professionals can worry about scaring patients with this information, research has shown time and time again that people with epilepsy and their families want to know about risks and how they may apply to them so they can take positive steps to reduce them. The majority of bereaved families who come to SUDEP Action after their loved one's death report that they weren't provided this information by health professionals. They often feel devastated to have been denied the opportunity to make changes that could have helped their loved one, and they carry the burden of guilt as a result. So, what is the checklist? The checklist was created for health professionals to use in appointment with people with epilepsy aged 16 and above in 2015, and provides a structured way to discuss key epilepsy mortality risks. It doesn't just cover SUDEP, but wider forms of epilepsy mortality. The information in the checklist is based on decades of research into epilepsy risks and SUDEP, and is regularly updated by SUDEP Action and the Cornwall Partnership NHS Foundation Trust. The paediatric version of the checklist was launched in 2024 for use with young people with epilepsy under 18 and parents of children with epilepsy. So, what does the checklist do? The checklist sets out the key risks known to be linked to premature deaths. The checklist shares research summaries for each risk so it is clear why they need to be discussed. It gives new health professionals and non-specialists prompt questions to guide their discussion. The checklist has a series of yes and no tick boxes to record each risk present and track change over time. It outlines recommended action steps that can help prevent or reduce the risks of SUDEP and seizures. It also provides signposting, either for the health professional or their patient, to support them in creating an action plan to reduce any flagged risks. The checklist has a list of research references showing the key research papers outlining current thinking on epilepsy mortality risks. And finally, the checklist can be uploaded to patient records, printed out or shared electronically with patients after the appointment to aid their memory on what was discussed. This is important given research shows it can take time for risk information to be fully understood and acted upon. So, why use the checklist? The checklist is free and available to any health professional seeing people with epilepsy and can be added into existing risk communication practice or documents. It is also accessible via MS Health and System 1 patient record systems for those in primary care. The checklist is supported by leading epilepsy experts across the UK who oversee its content to ensure the information provided is impactful and relevant to health professionals. Thousands of health professionals across clinical settings use the checklist as part of their risk management processes. The checklist is for use at regular intervals to keep an eye on changing risks. As research has shown, risks can become fatal in as little as 3 to 6 months. How regularly the checklist should be completed will depend on each individual patient, the number of risks they face, and how confident they are to take positive actions to reduce them. However, it should happen at least once a year for all patients. Research has shown that repeated use of the checklist over time helps people with epilepsy to better understand and identify their risks. It also showed that those found with many risk factors present at one appointment had a lower number of risks at later appointments. This was even seen with patients who were thought to have their risks well managed. People with epilepsy want to be empowered about their condition and want to be told of any risks they may face, just like any other people with serious long-term conditions are. They want to be able to make informed choices about their care, lifestyle, and treatment. Health professionals having this important conversation with them can be life-changing and life-saving, helping to create a positive culture of open, personalised communication as part of their epilepsy management. The SUDEP and Seizure Safety Checklist is a tool for any health professional who sees people with epilepsy to support them in having conversations with their patients about the risks linked to SUDEP and other forms of epilepsy deaths.